October 1st, 2011, my life changed. It was 2.5 minutes into the second half of our soccer game. I was running down the field, ready to take a shot, and a girl hit me from the side. My knee popped, and I couldn't put any weight on it afterwards. Later that day, I went to the hospital. They sent me to an orthopedic surgeon who sent me for an MRI. Within a month and a half, I had had knee surgery for the first time to repair my ACL. Immediately after my ACL reconstruction, I went to physical therapy. I learned so much from them. Not only did they help me with the physical part of returning to soccer, they also helped me with the mental part of the injury. However, insurance limited me to a certain amount of visits per year. If they hadn't, the benefit I would have gained from physical therapy would have been much greater. If I had been able to go to physical therapy more often, who knows what would have happened. I might be able to play soccer my senior year instead of sitting the sideline.
My name is David Seppi. I work at Physiotherapy Associates in Golden, also known as Golden Physical Therapy here. And I got my degree, a Doctor of Physical Therapy from Regis University in 2012, and I've been working here for 2 years. Even if people have insurance and they think that their plan is pretty good, their health insurance, a lot of times they're surprised when they actually get here and they see that their benefits are not what they thought. So they may be paying high premiums but still have a high deductible, and they might have a high copay. So we see copays as high as $50 to $60 per visit, which is pretty much full cost, almost full cost of what it would be if you pay out of pocket, just kind of paying without having insurance. And so not only are they copays, deductibles, but then they have specific number of visits limitations. So all of those things are really inhibiting to people. And then there are people that don't have insurance at all and can't afford it. Medicaid, they'll allow you to come for a couple visits, but again, they don't cover a lot. So we really have to work with less visits and give people more things at home to get by.
My name is Devin Dunn, and I was born with a fibrous dysplasia on my left distal femur. Fibrous dysplasia is a type of benign tumor that in many cases weakens the bone and causes injury. I work at a summer camp, and at some point during the summer I step wrong on my leg or trip. I'm not totally sure what happened, but it started hurting really bad, so I went to the medic, who thought I maybe hyperextended my knee. He sent me to Castle Pines Urgent Care, where I was referred for an MRI, and when I had the MRI, they noticed not only the fibrous dysplasia, but a fracture on my femur, one of the hardest bones in the body. Because of workman's comp, there wasn't much money, and I was limited to about 2 trips a week. I think I would have benefited from more hands-on, some more intense physical therapy, as well as some more specialized physical therapy. I got very general care.
Somebody had Medicaid and they came in, and we saw them a couple visits, but they had multiple knee surgeries, and the amount that the insurance company was willing to cover was less than 25% of what the person needed. And so we ended up doing in that case is seeing them as much as we could with the visits, and we're not able to do this every time because the business wouldn't continue to sustain itself, but we were able to see him just pro bono on the side, and he kept coming in to see him, but there was no way he was going to be back to normal function or anywhere near that without additional visits, and he probably would have just had another knee injury that would have led to more surgeries, but couldn't get the coverage. So a huge thing actually right now that's going through the state Senate, it got passed through the House of Representatives. It's called the Fair Copay bill, and they're trying to reduce copays and make them fair and reasonable for PT, chiropractic, a couple other professions, so that somebody comes in and they don't have to pay $60 per visit. I think it would be reduced to at least, I don't know, more around the $20 or $30 range, something that or less, so that people could come in and actually use their benefits and not be so limited by money. So that's one solution that's that we're working towards.